health outcome. So what I would say to your legislators and to those that are supporting them and people who are weighing in on this, you should strive, which is what we're trying to do in Kentucky, to get better health outcomes. That's my only purpose in wanting to have a waiver. I want what it takes to get better health outcomes for our people. And the way to do it is to have them engaged in their own health care, by whether they're working, whether they're volunteering, whether they're taking education courses or training courses. The bottom line is people that are engaged in the community, engaged in their own health, are much more likely to get better health outcomes because they have a vested interest in the process.
That's a great summation of the goals and the aspirations of the program. Commend you. Talk about the politics within the Republican Party, though. This Medicaid expansion, entitlement expansion. This is not in the creed, if you will, of Republican philosophy and thinking.
No.
So how has this been embraced within the party and frankly their politics? We're thinking about this in Virginia. We have elections in a year and a half, November of next year. Explain to people in Virginia what's the political experience been for a conservative Republican like yourself?
So I came into office and the expansion had already happened. Because it was done with executive action by my predecessor, I did have the option of, by executive action, completely removing all expanded Medicaid in our state. It was my intention initially to do exactly that. But as I started to look at this process, and this gets to not just the politics, but the policy of it as well.
Right.
If the point is to get people to a state of better health, and we as a state need that, here was the ability, if I could get permission from CMS, which is a division of HHS, the ones who oversee Medicaid, Medicare, if I could get a waiver that would allow me the latitude within Medicaid to come alongside people and provide the opportunity to become healthier, become more engaged, pay premiums, get engaged in the workforce, in volunteering and in training that helps them pursue the American dream and pursue active, healthier lifestyles. If I could use this through entitlement reform, then it would be an opportunity I wouldn't want to miss. And interestingly, we've not had any entitlement reform since the mid-90s with welfare reform. And this was a chance for Kentucky to lead the nation like no one had in a generation in transforming what it is we expect out of a federal entitlement program. So rather than just get it gone in lock, stock, and barrel, I said, if I can be given permission, then we will modify this because I think we'll be better for it. It will cost us more, but we will end up with a better, healthier population, and that will ultimately cost us less.